Okay, we've been talking about valvular heart disease. So what are some diagnostic studies that you need to know? Number one, echo, echocardiogram, ultrasound of the heart. Number two, chest x-ray. In a chest x-ray, you may find cardiomegaly, enlarged heart, you may find some fluid in the lungs, which will let you know that the patient may have some difficulty breathing. You also do an EKG to see if there's any changes or if there are any dysrhythmias present. You also do something like a cardiac catheterization. Now with the cardiac catheterization, you may also pay close attention to if on the Nclex it asks you something like anything that may point to IV contrast, because again, you must know if that patient has any allergy to iodine, any allergy to shellfish, if their BUN and creatinine is within normal limits. Because again, that will all have an effect on if they're going to have a cardiac catheterization and if iodine will be used. So what are some therapies, some treatments, some interventions for these patients? Number one, if they are suffering from heart failure, a diuretic may be given, again, to push some of that fluid out of the lungs. You may also be told to decrease sodium intake. If it is likely that these patients may suffer from blood clots, they may put them on some anticoagulant therapy, some Coumadin, warfarin. If dysrhythmias are present, I think I misspelled that. Dysrhythmias, you may give something like digoxin. You may prepare the patient for a valvuloplasty. Again, this would be for stenosis. You may do something like a valve repair, or the patient may opt for valve replacement. Now, if they have a valve replacement performed, they may get a mechanical valve or they may get a biologic valve. If they have a mechanical valve replacement, you must know, the patient must also be informed that these last longer. However, because it is mechanical, the risk for thromboembolism is higher. It increases. Therefore, they must know that they will be on some long-term anticoagulant therapy. Now, if they're going to get a biologic valve replacement, this may be from a cadaver. The patient must know that these are less durable. However, no long-term anticoagulant therapy will be needed, so that is a big difference. You will instruct your patient to avoid tobacco. Yes, we want these patients to be active. We don't want to run into other heart problems, but they must be informed to avoid strenuous activity. Remember that cardiac output to some extent is affected even though they have some type of valve replacement. Therefore, we do not want to overexert the heart. So again, we have to tell them to avoid strenuous activity. Number 8, if they do get a mechanical valve put in place, they must check their INR on a frequent basis. Remember that the therapeutic levels are between 2.5 to 3.5. Now again, they are more likely to also bleed because again, they are on a anticoagulant therapy. So again, monitor these levels very, very closely. We don't want to give them too much medication, cause other problems. Now this is a biggie that you must remember for the Nclex. If the patient is going to have any dental procedure done, they're talking about going to the dentist, remember you must inform them that they have to notify their doctor before anything is done. That is a big one on the Nclex exam. I've seen a lot of practice questions. So again, they must inform the MD if they're going to have any dental procedures performed. That's a big one. Number 10, make sure that you tell the patient to wear a medical alert bracelet.